When a public health emergency like coronavirus hits the news channels and starts to invade our social media feeds, it becomes a major topic of conversation for many. Often, the more we talk about an issue and therefore spend time attending to it, the more anxious we become about it. Kids are not immune from directly or indirectly picking up on this worry and anxiety. Because of this, it's important that we talk to our children about coronavirus to provide them with accurate information if necessary and to help them manage any fears or anxieties that come up. But having these types of conversations with our children can be challenging, particularly if we are unaware of the information or misinformation they're already been given. So here are some tips on how to talk to children about public health emergencies like coronavirus. First, it's important to ensure that the conversations are age appropriate. The types of frank conversations we can have with high school and university age children are not the same as the conversations we would have with those in preschool or elementary age. Second, when it comes to younger children, don't overshare and burden them with information or worries, but do answer the questions they ask. Be honest but conscious of age and learning level, the same way you might be with answering questions about where babies come from. Third, children are curious and want to learn about the world about them, so they are bound to ask questions. If you don't know the answer, tell them you will find out. Or, depending on the nature of the question and the age of the child, consider researching the answer together. Although, even though children are naturally curious, feeling secure and safe is important to their psychological well-being. Be honest, but always attempt to reassure them of their safety. And finally, educate children about their health and how to be conscious of staying healthy and preventing disease. Identifying actionable things we can do individually to keep ourselves safe and healthy can help all of us manage the anxiety, fear, and helplessness. This is also true for children, regardless of whether or not they are able to accurately identify these emotions. Make sure these things are something that are within their control, something they can do on their own or mostly on their own, and realistic and attainable. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, and avoiding close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. All of these actions are things that can be tailored to children's age and taught for them as a behavior to engage in within their control.